So you need to ask yourself the question, what is it that gets a diabetic sick? What sends a diabetic to the doctor, to the hospital, or to the grave, God forbid? Well, there are two major reasons that cause morbidity and mortality in diabetes. Number one is diabetics need to be considered as immunocompromised. Diabetics get much more infections than a non-diabetic will, and anything from infection in the toe to pneumonia to skin infections to fungal infections. So if you can raise the immune response in a diabetic, you can give that person an additional benefit of being more resistant to these infectious circumstances. But the major reason that diabetics get into trouble is because of their vascular system, their circulation. If the circulation in a diabetic is affected to their eyes, they get diabetic blindness. The circulation is affected to their kidneys, they get kidney failure. The circulation is affected to their peripheral nerves, they end up with a neuropathy. And diabetics have a much, much higher rate of heart attacks and stroke. So what's going on here? Well, in a diabetic, because of the environment that their cells live in, there's a much higher degree of oxidative stress. Okay, so diabetics have higher oxidative stress. Now, in our blood, we have circulating fat. The most common, which you've all have heard of, is cholesterol. Now, when these fats become oxidized, something we call lipid peroxidation, they turn stickier, so to speak, and they end up gumming up your arteries, and you develop plaques, and you develop poor circulation, and you have heart attacks and strokes and blindness and kidney failure and all of those terrible manifestations of long-term diabetes. So these fats are being oxidized. What is the substance circulating in our body that prevents these fats from being oxidized? It's a biomolecule called glutathione peroxidase. If you raise glutathione levels, you raise your glutathione peroxidase, and you're able to keep these fats, like cholesterol, in a safer state. So this is true preventive medicine. No, by raising glutathione, you're not lowering your sugar levels, but you're preventing the long-term sequela, the long-term consequences of having the diabetes. This is truly preventive medicine at its best.